Dr. Goldstein, talk about the common root cause of these diseases.
Yeah. Okay, I'm going to talk about something that's the equivalent of having a gang member in your head.
Okay.
Wow.
Okay? Yeah, as opposed to cobwebs.
Yes.
All right.
Okay. Good.
Okay. Well, first of all neurodegenerative diseases, their name tells us the story. They all have a commonality, and that's the diseases result from the dying or death of neurons, which are brain cells. When those brain cells die in different parts of the brain, different diseases occur. So that's just the commonality there. Wow. Secondly, as you mentioned early on, today there are no therapies available that allow to attack or neutralize the root cause, the underlying driver of these diseases. So what is it? Well, let's stick with Alzheimer's disease because it's the most prevalent of all these diseases. 47 million patients diagnosed worldwide with Alzheimer's.
Wow.
And probably a similar number who are developing the disease but don't have symptoms. So what's killing neurons in our brain? What is this gang member?
Yeah.
Well, it's something called a misfolded protein, or what we call an oligomer. Proteins in the brain tend to clump together naturally. They're sort of sticky, if you like, okay? And when they do this, they have a tendency to misfold. Proteins are complicated, relatively large molecules that are all sort of folded up in a complex structure. From time to time, they just misfold. Errors occur. When they misfold, they become directly neurotoxic. Worse than that, though, not only do they kill neurons that are in the vicinity of this misfolded oligomer, but these oligomers act like a template or a seed, and then any normal protein in the area of the toxic misfolded form also becomes toxic oligomer and kills neurons. So like the gang member in your head, the two hallmarks of all these diseases are the following. One, the toxic oligomer, like a gang member, is deadly. That's one of their worst features. What makes them even worse? They corrupt the kids in the neighborhood, and that's what these do, and that's how they spread progressively. We call it propagation, spread to the brain.